And what I want to ask you, Minister, is will you ensure that that money goes to frontline services? It absolutely has to, because we have situations like young people arriving up in Mayo University Hospital, not having any psychologist and being told by the medical team there that it's because we don't have the resources, we don't have the money to have a psychologist there. We have others arriving up that need to be prescribed medication, but the clinical person who needs to be there to prescribe and approve the medication isn't there. So that young person is let out again. So we have this revolving doors situation inside in A&Es who cannot cope as they are, then don't have the mental health teams, their full complement of the mental health teams in there to be able to treat and to be able to support young people that go in through A&E. So many times you can have them sitting there in the waiting room for hours and hours and decide that they have to go home again. Other times they can be hospitalised overnight and then they're sent back to the community again the next day without any proper treatment and maybe having to wait months and months for treatment that they deserve. And instead of us progressing and going forward, Minister, we have situations like where we have Mindspace in Mayo, and I would have worked myself personally for 5 years on that to get that developed. And it's a really, really good project. But we've had outreach to places like the more rural areas of Belmullet and Erris for the Mindspace programme, and all of a sudden there's no resources there to do that outreach either. And I am really, really concerned about where we are in relation to mental health and in young people, but indeed right through the life cycle in terms of the supports that are not there available. So I would ask you that the money that was allocated yesterday in the budget would be used specifically for frontline services.